Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
And welcome to Community Conversations. It's so nice to have you join us week after week, and we're always looking for both new topics as well as keeping up with some of the wonderful things that are happening in our community. Treasure Coast Community Health does provide primary medical, dental, behavioral health, and as I teasingly say, and now a fourth service product line service, whatever you want to call it, and that's COVID, because we continue to do testing for individuals at no cost 3 times a week, once at the county fairgrounds on Monday morning, at the IG Center on Wednesday morning, and again at the IG Center on Friday afternoon. And we encourage anyone who is asymptomatic but feels they might have been exposed and are concerned about the people around them being therefore exposed through them to get tested. It is free. We don't care how many times you roll through the drive-in line. And we also offer, for those particular circumstances that do require rapid testing as well. So we are doing that, and now we are also providing the actual vaccine against COVID. As many of you know, many of you have been calling in and asking to be put on a wait list, and we are working with the Department of Health so that we can get as many shots in arms as there is vaccine available. So thank you for your patience, your kindness, and most especially your trust in the services we deliver to people of all ages and races and ethnicities. We are truly healthcare for all people. But we do a lot more than that. We combine our efforts with a lot of community organizations. And today I've asked Randy Riley to come back and talk to us about the Senior Collaborative. This group started as a nonprofit some time ago. And it's really important work that we're doing when you consider that, well, I'll let Randy tell you how many, but there's a whole lot of seniors in Indian River County. So welcome, Randy.
Thank you, Vicki. Pleasure to be here again.
Well, the collaborative started 2 or 3 years ago.
We became a nonprofit in 2019, which really started us down the road that we're on right now.
So you know the statistics about seniors very well. How many seniors do live in Indian River County?
Approximately over 65, it's about 45,000.
That's a lot of people out of 150.
Yes.
Yes, it is. So you qualified over 65 because that's on everyone's mind now. But this is sort of a combined effort, or supported at least, by AARP, and they define seniors a little bit younger, don't they?
AARP defines seniors at 50.
Okay.
And even the group that we look at is probably 60 and above. Okay. But if someone has a need, we're definitely going to try to help them.
So tell us a little bit about the Senior Collaborative for someone who's just hearing those 2 words put together for the first time. What does that mean?
It's an organization that actually spun out of some things that occurred to me personally. One of them was my mother was terminally ill. I was trying to find assistance for her. We were moving her to Indian River County. And I quickly realized how difficult it was to match needs with providers. Mm-hmm. And I had been in Vero Beach for about 25 years at that point, was well connected with my background as a banker. Mm-hmm. And I figured if it was that tough for me, it was going to be tough for a lot of people. So.
And you're certainly not the only one who has brought a parent into the county so that you can spend more time with them, to help supervise their care, to perhaps be with them in their final days.
It's a story that we hear over and over again, mm-hmm. and several of my board members have experienced it, and that's why they're on serving as well.
Mm-hmm. So this is a not-for-profit, so it is funded by foundations and others?
The majority of our funding comes from grants within the community. We have had United Way has been very supportive of us. We actually are located on the second floor of their building, so they help us with more ways than grants. Johns Island Community Service League, Indian River County Hospital District, and then the Menotti Family Foundation have all been very generous, which allows us to provide all the services we do to seniors and actually our members at this point at no charge.
And so as the organization grows, you certainly would be willing to accept donations as a thank you to be made out to the Senior Collaborative.
Oh, we're willing to accept right now, Vicki.
I just wanted to double check. Okay.
And we do get contributions from the community, and it's definitely part of it. It's a need that we have to continue to grow and become larger and continue to provide additional services.
So let's talk about how you have taken that personal experience of trying to find the right match. How have you pushed that thought to matchmaking to make it easier?
When we started the concept, it actually spun out of United Way with Senior Resource and Alzheimer Parkinson's Association. Mm-hmm. And we had looked at the 2012 Senior Needs Assessment, which said that there was definitely a need to connect seniors with services. Okay. We looked at that and came up with a three-prong approach to being able to do that. One was we wanted to create a database of providers, and I'm happy to say that that came online as of August of last year. We have over 500 providers on our website right now.
That's great.
That are searchable by either category, name of the entity, or by keywords, such as if you're looking for an assisted living facility, mm-hmm. you put in assisted living and it will give you the list of assisted living facilities, okay. Excuse me, assisted living facilities in Indian River County.
If, on the other hand, someone were to call and say, what do you know about Sea Hope? I made that name up on purpose. Okay. As a rehab center, that might be in your database? It
would be in our database, but okay. You're also bringing up the second part of what we do with our navigation program, okay. and that is that people can call in. We will help them assess their needs, and then we will give them the providers that we think are appropriate. Okay. Our member
based
providers.
On needs.
Yes.
Okay. Just want to make sure it's all objective. There's no hidden referrals going on or anything that.
No.
Okay.
We definitely we definitely try to match the need to the provider.
And that is very helpful. That's why I said what I did about if you get a call, because I get a lot of those calls that will ask me, based on your knowledge, which one is better. And I can't say which one is better, but I can tell you about them. And so does your website. And so do you personally for those people who are not, say, website savvy?
Yes, we will give them 2 or 3 options that we feel are appropriate, okay. depending on what they're looking at.
And what's your website?
Our website is Senior Services IRC, as in Indian River County.
Okay.
.org.
Pretty easy. SeniorServicesIRC.org. Okay. So tell us how you guys are functioning now. Do you have a number of different people besides your board and members? Have you added staff, Randy?
We added staff last year. In addition to myself, we have a second individual who is helping with membership in the database and also taking calls that come in.
So a lot of need, still willing to take some additional funds and or volunteers because, as we talked earlier, once somebody finds your phone number and they are pleased, they spread it around town.
They certainly do, and that's a good thing for us because the concept of creating this was good, and we've done very well. The database has over 500 providers on it right now, and it grows daily.
What kind of providers? Is it just medical? We've talked about that briefly.
No, it just actually we do both nonprofit and for-profit entities.
Very important.
And it goes all the way from healthcare to or you can go play pickleball.
Ah, okay. Cleaning services, those types of things.
That one we haven't added yet.
Hint, hint,
maybe
audience. There's an opportunity.
So, yeah, but
Concierge type services for someone who doesn't like to go out and drive a lot, maybe picking up laundry or things like that.
Transportation is definitely a factor that we look at, and there are transportation options listed on the website.
So we mentioned a phone number. Give us that again.
772-469-2270.
Okay, so 2 A's right now of, he's double thinking there.
Yeah.
I saw that.
Yeah.
Want to say it one more time?
772-469-2270.
That's wonderful. We're going to take a short break for a word from our sponsors, and when we come back, we'll talk about some of the other initiatives that the Senior Collaborative is involved in. Okay?
Sure.
Maison Martinique at the Caribbean Court is now open for fine dining, offering a special 4-course Valentine's dinner on February 13th and 14th. Choose from multiple plates for each course, including sumptuous entrees such as rack of lamb, lobster primavera ravioli, Caribbean salmon, and 5-star sides, appetizers, super salad, and dessert. Reserve in the romantic Maison main dining room, the alfresco patio, or upstairs at Havana Nights Piano Bar with live music. For takeout orders and reservations, call 772-231-7299 or reserve your table online at Open Table. And meet the new chef, Joseph Hastings, cooking from a scratch menu, meaning only the finest fresh ingredients at Maison Martinique. Celebrate Valentine's Day at Maison Martinique and Havana Nights.
If your total household income in 2020 was $57,000 or less, the United Way of Indian River County will help you get your taxes done for free. Let our knowledgeable IRS-certified VITA volunteers save you the stress. They'll prepare and e-file your taxes for you. Visit unitedwayirc.org/taxes to see all of the documents and forms of family ID you need to bring with you for your Valet VITA appointment at our United Way Center on 14th Avenue in Vero Beach. If your total household income in 2020 was $57,000 or less, there's no need for you to pay any filing fees. IRS-certified VITA volunteers at United Way of Indian River County will help you get all of the tax credits you're entitled to without having to pay. Go to unitedwayirc.org/taxes for Valet VITA instructions and to make your appointment. Or call us at 772-203-5766 if you need assistance. Maximize your refund. Make your appointment online or call us at 772-203-5766 today.
And welcome back to Community Conversations. This is Vicki Soule as your host from Treasure Coast Community Health. So I'm going to give just a little plug to any of the seniors who are by the radio reception. I almost said the radio dial, but that certainly is dating me these days. Nonetheless, I just want to remind seniors and everyone that's out there in our listening audience that we do provide primary care for people regardless of their income or ability to pay with insurance. We certainly love it when you bring insurance to us. That is a more guaranteed payment of usually a higher value, and we do aim to be just as darn good as anybody else in town that you might consider. So if you don't have a provider yet, give us a try. Today I'm with Randy Riley, who is here from the Senior Collaborative as its executive director. Randy, it's so good to have you back. I can't believe it's been almost a year since you were here talking about what was then a startup, and you've come a long way with members and a website that has navigation capabilities. And you brought in some material, including what I recognize as your monthly newsletter. So tell us how people could get more information sent to them.
You can go to our website and request to be added to our mailing list. And we send out information periodically that pertain to seniors.
Okay.
So,
As does your website. I've seen you do pretty regular updates to that to keep people abreast of what's going on.
there's a lot of information. Currently, there's a lot of COVID information on the website as to where you can go to get vaccine, how you sign up for it. With that said, that changes daily, as
Yes,
you
it
are
does.
well aware, and the players keep changing on a daily basis as
Well, the
to
governor
who's
keeps
providing
making
it.
changes,
Yes,
so
definitely.
it's an interesting time.
But there are news items out there pertaining to seniors.
Okay. And so we've talked about the website and we've talked about the phone. What's future plans for a more face-to-face once we're done with COVID?
Well, our original goal was originally a three-prong approach, and the third prong is what we call our connection center. And I'm pleased to say our board of directors has decided to begin working on that project. We think it's probably 2 years out, but what that will provide is a facility, in addition to the website, in addition to the phone, that individuals, and let's include family members, caregivers to that group, and because we get calls from all of those. But the Connection Center will actually provide that facility that people will be able to come. We will have a caseworker there that would be able to provide information. We envision having a library with brochures from all of our providers. And touch screens if you want to go on and look at things that way.
So sort of a mix between the Chamber of Commerce, especially for seniors, and maybe like the Mental Health Collaborative, where it's bricks and mortar, but it's sort of a one-stop shop for anything that might be troubling them, or they need additional assistance and just aren't sure where to go to ask those related questions.
That's why we're there. And the Chamber of Commerce is a interesting analogy. It's one that I have used periodically. We don't purport to be a chamber, or we're not in competition with the local Chamber of Commerce, but it is certainly
a similar
It's a similar
concept. Okay. Yeah. Okay. So that is in the future. And again, if people are interested in that or interested in anything that we've talked about, you are still accepting people, I don't want to say volunteers, but more invested members into this group?
We have we actually have a number of different types of members.
Okay.
But it was the predominant ones are providers. Second is our funders, and third is advocates for seniors. If you're interested in advocating for seniors, we would love to have you be a member.
That's wonderful. As many of our families are advocating for the seniors in their life, and sometimes from great distances. You mentioned at one point folks that are up north, and they're trying to manage mom's care. Mom keeps saying everything is fine, but you're wondering if it really is based on other things you've heard in telephone conversations or from other relatives or maybe even their neighbors.
That's actually pretty normal and something we see quite often where, and in fact, on the majority, I'm not going to say, let me rephrase that. A large portion of the calls that we get are not from the client themselves or the senior themselves. It's a neighbor, it's a friend, it's a family member who is trying to assist them with a need.
Okay. So feel free to call
772-469-2270.
That's awesome. So I alluded to the fact that you're involved in some other things, and that would be the livability surveys. You want to fill in some blanks around that concept?
Sure. In 2020, Indian River County became an age-friendly designated community. What spun out of that was Livable Indian River, which is a sub-organization of our collaborative, and we are in a 5-year program right now. Year one is to do a community assessment, which we are in process of doing. Year two, we will be putting together an action plan, and years 3 through 5, we will be advocating for what comes out of the assessment and the action plan.
Okay, so, another survey. I can almost hear people saying that. My goodness, what could they possibly ask that hasn't been asked before?
This one is much more specific to older individuals, and the main concept of livable community is trying to allow people to age in place.
Okay.
To be able to stay in their homes. There's different needs for that. It could be as easy as grab bars in the bathrooms, or looking for a different residence that's smaller, or needing health care,
changes,
transportation,
Okay.
just everything in general. We basically we look at 8 different domains as we go through livable community. The main ones being housing, transportation, health.
Some of the social aspects.
Yeah, there's both civic inclusion, social inclusion,
Okay.
communicating, which is very important for us as something we feel we do in communicating to seniors what's going on in the community.
Okay. And so the 8 domains and the entire idea of a livable community, there are other communities in Florida that are already ahead of us in that. Is that correct? They sort
The
of
first one was
model it?
actually Sarasota County,
Okay.
and it goes back to, I believe it was 2012.
Okay.
So they have been doing it for quite a while. And this is actually a program that was set up by the World Health Organization. AARP is the national oversight for livable communities, and we work with them very closely as we go through this process.
It sounds an awful lot like a community health center. Community health centers have sort of general guidance and oversight from HRSA, the Human Services Resource Administration, but they're very clear that each community has different needs and different ways of solving those. And that's pretty much what you're talking about when I think about Sarasota. What they may have focused on out of their 8 domains from their survey assessment might be very different than what Indian River County is doing.
There's over 40, last count there were 48 different communities in the state of Florida.
Okay.
Each one of them has a different action plan. And although we're looking at all 8 domains, it does not mean that there are going to be needs in all 8 of the domains. We know that affordable housing is an issue in Indian River County.
Yes, we do.
We know that obtaining information is a need in Indian River County.
And yet we're pretty well suited on transportation because we have both the community coach as well as a free go line, whereas other communities might have transportation be their number one issue. So that makes sense.
The scoring that we're seeing on transportation is coming, but the initial scoring we're seeing from the assessment is coming back very positive for transportation.
So when you talk about the survey, the assessment, as you call it, are you still collecting that information from individuals?
Yes,
and
we definitely are, and we will continue to do that through the end of June.
Okay. I'll bet that's on your website, too.
Yes, the assessment is on our website, and as of Friday of this week, we will also have paper copies of the assessment in all 3 of the libraries that are open. Wonderful. And also United Against Poverty. You can go to their facility in Vero and
if you get
there.
in line at a TCCH COVID vaccination site, you'll be handed the ability to do that as well, either in paper or...
And we thank you and TCCH for doing that for us.
Well, I just wanted to include that. There's a lot of confusion about who's doing what, and so, we do support your efforts for all things senior. Even though the bulk of our patients are less than senior age, no matter how you do that by 50, 60, or 65, we still feel very strongly that it's to everyone's best interest to participate in the senior collaborative efforts. So.
Can I quickly add one more thing?
Sure. Very quickly.
Very quickly. I just want to mention that although we have 500 providers on the website, we provide a complimentary listing on the website, and our membership is also complimentary. So if you are a provider for seniors, please give us a call, and we would love to add you to our organization as a member.
Perfect. Thank you so much for being with us today, Randy. It's been enlightening as always. Thank you.
Thanks, Vicki.